Now that we have completed patient positioning, let's move on to our next topic, scan planning and parameters. We are going to look at how to plan a routine brain CT scan using the SCOUT image and discuss some of the important scanning parameters that help us achieve good diagnostic image quality. This is a very important part of a brain CT examination because proper planning helps ensure that the correct anatomy is covered and that we obtain good diagnostic images while avoiding unnecessary radiation exposure. Let's start by looking at the lateral SCOUT image and see how we plan our scan. After positioning the patient, we acquire the SCOUT image and use it to plan the scan. What is the usual scan range? Standard range starts from the bottom of C1 and it goes straight up to the top of the head. The routine scan range should cover the brain from the foramen magnum to the vertex. What parameters should we consider? Important parameters include tube voltage, tube current, slice thickness, rotation time, and reconstruction settings. However, parameters should always be adjusted according to the scanner, patient, and clinical indication. If CT head with IV contrast only is ordered, skip the head without contrast series and use the next series on. So in summary, proper scan planning begins with a correctly acquired SCOUT image. We carefully define our scan range, select the appropriate parameters, and ensure that the entire area of interest is covered. What about the radiation exposure? Remember, good planning is essential for obtaining diagnostic quality images while avoiding unnecessary radiation exposure. Now that we have completed the scan planning and selected our parameters, we can proceed to the next stage of the brain CT examination.